There's more to it than this. You've probably heard that PCOS is about missed cycles, but that is like the hormonal tip of the iceberg. Hi, I'm your local OBGYN. I love women, and let's talk about it. Polycystic ovarian syndrome, or PCOS, is something that affects about 1 in 10 women. It sometimes even shows up before we even know what a regular cycle even is. Besides missed periods, PCOS can mean that you have excess acne on your face, on your chest, on your back, funny hair growth in more male patterned locations. These are very much a result of excess testosterone that's circulating in your system from hormonal disruption. Hormonal changes can also affect your hair. You can start to see more male patterned thinning again from that excess testosterone. There can also be really a lot of difficulty in your weight and controlling it and keeping it balanced, as well as fertility struggles that go along with this. And this is a result of dysregulation of your estrogen, testosterone, and then it can start to go into your insulin and your lipids as well. And this can lead to a more overwhelming hormonal issue called metabolic X syndrome, where it all just kind of is a catch-22 swirl that feeds into itself and makes everything getting corrected so much harder. One of the biggest myths of PCOS is that you have to have cysts on your ovaries in order to actually get the diagnosis. And this is actually not something that I find true in a good number of my patients. Lastly, there's not a certain typical look to PCOS, which was not always the case. People felt that it had to be somebody that was heavier that was affected by it. But it's really a hormonal function issue where the chemistry and balance of your system has lost control. Some women are going to be more genetically predisposed than others, but it's the tightening up of whatever your hormone balance is, which is going to be different from everybody. And you'll know this when you start to see correction of some of these excess things that are going on. If your cycles are unpredictable and you've just been told to kind of like wait this one out, you may want to come in and see your local OBGYN, get a lab panel, get like a good physical, because sometimes we can even start to just see that between your history and your exam, we know what's going on before we even do the test.